This podcast is brought to you by Varietea.
Hi, what's up everyone? This is Nisa from Variety and you're listening to the Miss V to Cut It or Not podcast, the place to be to create a business and life you love. So welcome back. I'll be your host in this episode on Miss V to Cut It or Not. Sounds interesting, isn't it? In this episode, I will share some insights and revelations about female genital mutilation and why is it matters for our knowledge, as well as why it should be avoided. I believe that not everyone that listens to the podcast are aware about FGM or known as female genital mutilation, and hereby I am to let you know about it, and I really hope that people will be more aware on how concerned this issue about. Do mind to share? The terms FGM are the same as FGC, which are female genital cutting. By the end of the podcast, I hope that you will be able to discuss the who, what, where, and why of female genital cutting, as well as some of the recent developments in its use. I also hope that you can figure out the short-term and the long-term effects of FGC or FGM. Before we go into any of that, let's take a step back and have a conversation about what female genital cutting is and where it's most widely practiced around the world. When talking to a healthcare practitioner, women who have their periods cut, or even amongst different sources in the literature, you will frequently hear multiple terminology used to describe the procedure. All of these terms are used, and it is frequently most suitable to mimic the language that the patient uses to describe their own experience. Throughout the entire of this podcast, we will most often refer to the practice known as female genital cutting, which is commonly abbreviated as FGC. According to the World Health Organization, the term female genital cutting refers to all procedures involving partial or total removal of female external genitalia or other injury to the female genital organs for cultural or other non-therapeutic reasons. In other words, FGC refers to the practice of cutting the female genital organs. The practice of female genital cutting is most common in sub-Saharan Africa and in the Middle East. To be more exact, the countries with a frequency of the practice that is more than 80% are as follows: Somalia, Kenya, Djibouti, Egypt, Eritrea, Mali, Sierra Leone, and Sudan. In point of fact, female genital cutting has a prevalence of up to 98% in Somalia. And there is no medical benefit associated with FGC, and it is associated with a number of risks and complications. During the process, the instruments that are utilized are typically heated stones, knives, scissors, or razor blades that have not been appropriately sterilized. Due to the lack of sterility immediately following the surgery, young women have a higher risk of contracting infections, including HIV. It is possible for a local inflammatory reaction to cause swelling in the genital area, which can then lead to urine retention and dysuria. Injuries to the urethra that occur during the surgery have the potential to cause urinary problems. Shock can be brought on by a variety of factors, including severe pain, bleeding, or an infection that has progressed to septic shock. FGC also carries with it the risk of fatal complications. So, you must be wondering what are the potential long-term effects if the practice has been done to someone. Chronic pelvic discomfort, dysuria, dysmenorrhea, anorgasmia, and dyspareunia are all potential long-term medical and sexual effects of female genital cutting. In the most extreme circumstances, young women are unable to urinate or pass their menstrual products. In addition, research has indicated that girls and women who have had FGC are at a greater risk of experiencing recurrent infections of the urinary tract. There is evidence that obstetrical difficulties can arise, such as an increased likelihood of delivering the baby via caesarean section and obstetrical lacerations occurring during vaginal birth. And not to forget, the psychological effects of female genital cutting should also be taken into consideration. Women who have had female genital cutting have an increased risk of suffering from anxiety, post-traumatic stress disorder or known as PTSD, low self-esteem, somatization, and specific phobias later in life. So why? Why is female genital mutilation still practiced if there is no evidence that it benefits well-being? There are few reasons that are frequently reported. First, FGC is thought to preserve a girl's chastity until marriage by both reducing her libido so that she can refrain from engaging in extramarital sex and ensuring that her husband can be the one to open her on their wedding night, which means that he widens the vaginal opening by cutting or stretching the tissues. This is done so that he can perform sexual acts with her. Since female genital cutting is regarded as a rite of passage and upheld as a social norm in many societies, girls feel pushed to go through with the process in order to be socially accepted and to improve their chances of being married. That wraps it up for today's episode. I hope this podcast could benefit you to realize more about FGM and FGC. If you're getting value from this show or have feedback, feel free to reach out to us at IPRMSA Melaka. Thank you for listening, and remember, if you want to support what we do, then share, subscribe, and leave a review over on this channel. And if you have any requirement, remember, we are always ready to assist you.
1, 2, 3, 4.
This podcast is brought to you by
Varietea.